Hey guys, Patient T here, and I'm coming to you today to bring you some information on how to take care of your freshly new transplanted hair post operation. So you've just underwent a hand transplant, huge deal, huge investment, and hugely exciting because some big changes are happening underneath your scalp. Some big, some really cool and new growth and exciting times. So anyway, basically you're going to have the procedure. You're going to head home. You're going to feel great. You're going to have no pain, and you'll have a light meal. And then at about 11 p.m. that night, it's going to kick in. You're going to be like, "Ow!" The meds have worn off. You will feel it quite tight and quite sore, especially if you've had strip surgery. I can't speak for FUE. I'm speaking purely on follicular unit transection, FUT. So basically, it's gonna hurt. So you're gonna have a bag full of painkillers, and you can have some awesome sleeping pills. Just take as many painkillers as they allow you to take. Obviously, don't overdose. Same with the sleeping pills, and you're good to go to bed. This is going to be your new best friend, an aeroplane pillow, especially if you have had hair transplanted and placed in your crown region. I mean, if you've had it just in, receding at the temples or filled in certain areas on the top and the front, this really isn't necessary. But a few pillows give you a 45-degree angle elevated. It's basically, like I said, just going to stop this area from rubbing and dislodging any grafts. So you'll sleep really well, nice and comfortably. I do advise sleeping on your own, or just with at least a decent amount of space, because you're gonna need the space. Next day, first wash, you're going to go back to your clinic and hopefully they'll do it. If not, then I'm sure they'll give you instructions on how to do that, some tips. Basically, I went into the shower and got a sponge, fill the sponge up with water, squeeze the sponge, wet the area, get the baby shampoo or the antiseptic shampoo, whatever it is, the shampoo that they give you. Grafts FUT is another one that they recommend. It's got copper peptides. I'm not sure, on how successful that is. Apparently, it just helps the grafts healing quicker. But basically, whatever shampoo that they give you or that they recommend, you can squeeze into the sponge, lather it up in the sponge, pour onto your scalp, and then rinse off the same way, rinsing off with the sponge. Or you can lather up the shampoo in your hands. Obviously just squeeze the sponge, the gentle stream or whatever it is, on to get your hair slightly damp. And I did pat all over my scalp. That's fine. Obviously, you just have to be extremely gentle, and everything will be fine. With the back area, you can be a little bit more vigorous with that. Not obviously crazy, but just you can scrub that. That's fine. Same with the sides. Drying, you can either use a hairdryer in a low setting and on a cool setting, or you can. I got a towel or a tissue, just pat very gently, pat dry, and all is good. So that's cleaning and taking care of it. Some other things that I can recommend is, if you bump it, if you are unlucky enough to bump your head and you dislodge a graft, you will notice it and you will feel it. You'll see blood trickle down your scalp. It will bleed. First thing you do, the quickest thing you do, is get some tissue, pressure, till the bleeding stops. Yeah, and you're probably going to see the lost graft, and it's going to look like obviously a hair with a pretty big bulb attached to it. And unfortunately, that is gone. So there's no point in crying or being upset over that. It happens. Hopefully you've had thousands replaced in other areas, so it's not really going to make that much of a difference. So don't freak out too much. Just be very careful when hopping into cars and taxis or walking around. Just be very, I was very aware of what was around me and above me, and probably overly, but I found it really helped. So swelling does occur. I found my clinic gave me a headband that went all the way around. I wore that for 3 days, and so I didn't experience any swelling. That was great. Yeah, itching. Itching is an issue. Usually around day 3, I was extremely itchy. Was asleep one night, and I itched my scalp. Woke up freaking out. Ran into the bathroom, checked, and it was fine. There was nothing lost. Um, Everything was okay. But basically, what I did there from then on, just didn't want to take any more precautions if I woke up, uncontrollably itching my scalp in my sleep. Was I got tissue paper, wrapped it around like a bandage, soft at that, both hands, so I slept with my hands like a mummy. Some people recommend wearing gloves. I just found this was a really good idea because it was really soft that way. If you do touch your scalp, it's just tissue. So yeah, that really helps with that. Now another one that's sex. No sex for 7 days. I know some places say that after a couple of days, basically it's just you got to avoid sweating. So that includes any vigorous activity. So no physical activity for a couple of weeks at that, at least 2 weeks. But sex, I think that if you're just going to be very gentle and not sweat too much, then that's fine. But yeah, I would avoid it. If you're lucky enough to have a partner, this may be an issue for you. But if not, then hey, it's just no masturbating for at least a week. Obviously, it just increases blood flow to the scalp, and it just increases your blood pressure. So you don't want to do anything to jeopardize it. So I would and also you could stretch the scar, especially if you're lying on your back or just in certain positions. So that's that topic. Other than that, just take lots of photos, take very good care, relax, really do your best to relax, have a good playlist, just try not to overthink about it too much, just keep an eye on it, ask your surgeon any questions that you need to via email or by phone call. Usually, that's part of their job, and then they're used to dealing with patients freaking out. So don't hesitate to ask even what feels like the most stupidest questions. Sorry. Trust me, I asked so many, it was ridiculous, like so many. So that's it. So congratulations. I wish you all the best. Another recommendation is just I read this book. I've been reading this book. It's Hair Loss and Replacements for Dummies. It's actually written by Dr. Bernstein, or however you pronounce it. I had the privilege of having a consult with him when I was in New York, but unfortunately the Aussie dollar dropped considerably and it just would work out to be thousands more. So he's one of the world's leading hair transplant surgeons, and he's all the information you need is in this book. There's a whole section on transplant alone, aftercare, postcare, pre-care, what to expect, what to do. So that's just been like my Bible. So that's been awesome. Anyway, it's been great. As you can see, I've got still a few scabs there. Tonight was the very first night that I gently scrubbed, but 10 days grafts are secure. You're pretty good. So I'm just going to, over the next couple of days, gently cleanse out until most of the scabs and crusts start to come off, and obviously then is the shedding phase, which is expected. Some people are lucky enough for the hair just to continue to grow straight away. If you do, that's great. So I'll just quickly show you the donor side. This is a bit awkward, but I got them to shave the sides, and I got them to keep the long across the strip. So it probably looks ridiculous because they just said it would be a good idea. Otherwise, this would be like a number 1 or a 2, and it just would make the scar really exposed. And more so for healing purposes, I just thought that wasn't really a good idea to have it that short. And obviously I didn't want people looking at it. But even though not that it looks great as it is now, so vanity out the door for the moment. It is what it is. Anyway, take care, and keep in touch, and I'll keep you well informed. Cheers, guys.